Come in.
Hello.
Hello.
Hi, how are you?
Good, and you?
Good. My name is Moruph. I'm a family nurse practitioner student with United States University. Today I'm going to be doing some examination on you. I'm going to do your thorax and lung examination. Is that okay? The other thing is that this video is being recorded. I'm going to submit it on YouTube for my professor to view me and grade me. Is that okay? Can you tell me what your name is?
Jace Josephs.
What's your date of birth?
10/17/14.
Okay. How old are you?
I'm 8 years old.
Okay. So here is my patient. He's 8 years old. I'm going to start the assessment. Can you stand up for me? Okay, very good. Can you take off your shirt, please? So I'm going to start with inspection, okay? The first thing I'm going to do is I'm going to inspect your chest, okay? I'm checking for any deformity on your chest, okay? Can you turn this side? Okay, I'm looking for any deformity. I'm looking at the rise and fall of your chest to see if you're having problem to breathe. I'm looking at the symmetry of the chest wall. Okay, so I'm looking at the I'm looking for deformity now. Okay, and to see if your chest is symmetrical. I'm going to look in the front, anterior and posterior. Okay, so I saw that his chest is symmetric and symmetrical, both back and front, and he's not using his accessory muscle to breathe, no retraction, and he's not using his diaphragm to breathe. The next thing I'm going to check is called AP ratio, okay? So I'm looking at your anterior and posterior diameter. Anterior posterior diameter. So your AP ratio is about 0.5 centimeter, all right? So I'm also going to check your respiratory effort and movement and check your respiration too for 1 minute. So I'm checking his respiration now. Your respiration is 17. So you're not using accessory muscle to breathe. You're not using your diaphragm to breathe. And there's no retraction. You're not having labor breathing. So I'm going to look at the back too. Okay, that's good. The next thing I'm going to do is I'm going to check his fingernail for cyanosis, okay? Can you give me your hand? So I'm checking your fingernail for clubbing. Okay, there's no clubbing. I didn't see any sign of cyanosis. Okay, and the other finger too. No clubbing. I'm checking for clubbing on the fingernails. I didn't see anything and no sign of cyanosis. I'm looking at the color of his finger to make sure it's not bluish, which is an indication of cyanosis. I'm also checking his lips for cyanosis to make sure it's not bluish. Very good. So that looks great. I didn't see any cyanosis. The next thing I'm going to do now is I'm going to check your respiratory excursion. Okay, stand up for me. Okay, your respiratory excursion. I'm going to place my two thumbs on your chest. Okay, and I'm going to squeeze in. Inhale for me. Okay, very good. Release. Okay, very good. The same thing at the back. Inhale for me. Release. All right. So I check for respiratory excursion in this section, which is palpation. So the palpation section now and the respiratory excursion is about 3 centimeter. Okay. The next thing I'm going to do is some called tactile fremidus. So I'm going to do your tactile fremidus. Okay. I'm going to place my hand on your chest. Okay. And I want you to say 99 for me.
99, 99, 99, 99, 99, 99, 99, 99.
Any pain or tenderness?
No.
Okay. And at the back too. Say 99.
99, 99, 99, 99, 99, 99, 99, 99.
Raise up your hand.
99.
Okay. I'm palpating for vibration, and it said 99. I can feel the vibration. The next thing I'm going to do is called costochondra. Okay, so with costochondra, I'm going to be palpating your rib cage to see if there's any tenderness or inflammation of your rib cage. Okay, you don't have to say anything. Any pain? Any pain? Okay. Raise up your hand for me. And I'm going to do the lateral aspect. Okay. Any pain?
No.
Okay. No pain here? Okay. So I palpated his rib cage bilaterally. He said he's not feeling any pain. And I also did the lateral side. All right. So the reason why we perform this test is to check for inflammation of your rib cage, because sometimes the pain that you feel from inflammation of the rib cage can mimic angina, like a chest pain. So we try to rule out that you're not having a chest pain and it's just inflammation of your rib cage. Okay. So the next thing I'm going to do is called percussion. Okay. So I'm going to percuss your anterior and posterior lung fields. All right. So let me stand up for that. Okay. Can you face the camera, please? So I'm going to percuss your lung fields. Okay. So, and it's going to be, the percussion is going to be like in ladder fashion too. All right. So I'm using the middle of my finger to place on the skin, and the middle of my finger to palpate, to percuss, I mean. All right. I'm going to start from the apex of the lungs. And I'm doing the lateral aspect now of the right. And the sound that I'm hearing is resonance. The same thing on this side. I'm going to percuss, pick still up like that here, from the apex of the lung with my middle finger. And on the lateral aspect too. And the sound that I hear is resonance. And I'm going to do the back too, from the apex. And I'm going to avoid the scapula there. That bone, I'm going to avoid it. Okay. So I'm going to do the second side. I'm going to do this side. Pick up your hand for me so I can get your, again, I'm avoiding the scapula. I will palpate, I will percuss his lung field. Okay, and I'm going to do the lateral aspect. So that's percussion, and the sound that I hear from is long field percussion is resonance. The next thing that I'm going to do now is called diaphragm excursion. Okay, can you face here for me? So I'm going to measure his diaphragm excursion now. I would like you to take a deep breath for me, okay, and hold it. Let's start from the front here. Take a deep breath and hold it for me. And as soon as you hear like a dull sound, right there, and I will mark it. Okay. Okay. Exhale for me and hold it. Okay, right there. Okay. The same thing on this side. Inhale for me. Dull sound. Okay. Exhale for me and hold it. Okay. Okay. And I'm going to measure them. So 3 centimeter, 3 centimeter. I will do the same thing at the back. Diaphragm excursion. I'm going to percuss again down. Okay. Dull sound. Exhale for me and hold it. Okay. The same thing here. I'm going to percuss. Dull sound. Exhale for me and hold it. Okay. And I'm going to measure it. 3 centimeter. 3 centimeter. So I did percussion of his diaphragm excursion and measured the size. So what I did is I percuss his long field until I hear a dull sound and I mark it, and from that area I continue. Well, I will tell him to inhale for me first. Inhale for me. He take a deep breath for me in, and I told him to hold it. So I percuss his long field from up until I hear dull sound, and the dull sound I mark it. Then I continue while I told him to exhale and hold it. And I also, when I heard the other dull sound, I mark it. So I measure the distance, and it's 3 centimeter. And this is what I did on both sides. Okay. Are you having any pain now?
No.
No pain? Okay. So the next thing I'm going to do is called auscultation. Okay. I'm going to listen to your lung sound. So we're going to move to auscultation now. Okay. And I'm going to start the auscultation from the apex of the lungs up here. Take a deep breath and hold it. Deep breath and hold it. Good. I'm going to go to the lateral aspect now. Raise up your hand for me. Take a deep breath and hold. Very good. And I'm doing the other side too, from the apex of the lung. Take a deep breath and hold. No, take a deep breath and out. Sorry. Deep breath and out. So let's start from here again, because I thought I said take a deep breath and hold. I want you to take a deep breath and out, okay?
Okay.
Deep breath and out. Take a deep breath and out. Very good. And I'm going to the lateral aspect. Take a deep breath and out. Take a deep breath and out. Okay, very good. The same thing on this side. Deep breath and out from the apex of the lung. Up here. Very good. In and out. Very good. In and out. And I'm going to the lateral aspect now. In and out. In and out. Very good. We're going to do the same thing on the back, okay? Thank you very much. From the apex of the lungs. In and out. Very good. Very good. And I'm going to the lateral aspect now. Pick up your hand. In and out. Okay, I'm going to do this side too. In and out. In and out. In and out. And I'm going to the lateral aspect now. In and out. So I listened to his lungs. I didn't hear any crackles, stridor, wheezes, any abnormal sound. I didn't hear any crackles, stridor, wheezes. So his lung sounds are normal. The last test that I'm going to do is called bronchophony. It's a special test. So with bronchophony, I'm going to place a stethoscope on your chest, and I want you to say 99, okay? I want to be able to hear you loud and clearly, okay? 99.
99.
99.
99.
99.
99.
99.
99.
99.
99.
99.
99.
99.
99.
99.
99.
99.
99.
99.
99.
Okay. So I just did a bronchophony test, and I can hear him loud and clearly. So that test is normal. Do you have any question for me?
No.
So this is going to conclude our test today. Thank you for taking your time with me at the clinic today, and I will see you shortly at the clinic on your follow-up. Okay. Okay.